the word cancer is unique amongst a lot of other words in that the mere thought or mention of it can produce a visceral reaction, most of the time, an anxiety inducing reaction. Um, Breast cancer is no different than other type of cancers in that front. Um, it should first be noted that it is normal to feel these visceral reactions. It is normal to be anxious at any point during your breast cancer diagnosis, workup, treatment, whatever. It is normal to feel anxious, to feel depressed, to feel uncertain. Any type of feeling that you have about breast cancer, whether or not you've been diagnosed or not, you have a family member, a friend, whatever. It's normal to feel that way. And if you are having these feelings, you need to speak to a medical provider, whether that's your primary care physician, a therapist, your breast surgeon, your oncologist, a breast radiologist. Any healthcare provider would be more than happy to help talk you through some of these feelings. That being said, knowing some of the statistics that are involved in breast imaging and breast cancer, I think are important in helping mitigate some of these feelings. Um, Getting breast cancer today is a lot different than it was 20, 30 years ago. The mortality rate of breast cancer has decreased by almost 40% since 1990. And a lot of that is due to early detection from mammography and advances in therapy. Um, Starting with breast cancer imaging or breast imaging, I always tell patients that the odds are forever and are always in your favor, right? Kind of like Hunger Games. Um, Out of 100 women who develop, or out of 100 women who get a mammogram, approximately 10% of them will be called back. We have to evaluate something. And of those people that are called back from their screening, the 10 that are called back, only 2 will have a biopsy. And out of those 2, only about a third of them will be diagnosed with breast cancer. So if you think about it, a third of 20% of 10% is a very small number. Not insignificant amount enough for you to postpone your mammogram, but it is a very small number each step of the way along your breast imaging workup. The chances of you going to the next step are small. But if you are one of those few who are diagnosed with breast cancer, just know that the mortality, the 5-year survival rate of breast cancer is 90%. And that includes, the most advanced stage of breast cancer. So if you're getting your mammograms yearly, you're not ignoring symptoms, you're getting worked up, the chances of you being diagnosed with an advanced stage breast cancer are low. And it's those early detected breast cancers that have the highest rate of survival. The 5-year survival of localized breast cancer is greater than 99%. So just because you're diagnosed with breast cancer, yes, it is serious, but that doesn't mean 100% that the breast cancer is going to, lead to your demise. So just keep these statistics in mind as we move forward in workup, treatment, diagnosis, and whatever, recovery. And if you're feeling these symptoms, it's normal. I'll reiterate, please speak to someone.